Welcome to the new era of video. Today we will talk about nosocomephobia and the value of continuity of care in promoting self-efficacy by clients. By Dr. Latifa Dardas.
أهلا بالحضور الكريم. شارك بصنع هذا الفن كل من الطلبة التاليين: رامي الشباطات، أحمد أيوب، صبحي ياسر، منيب يونس، ومحمد علي.
Our outlines for today's lecture will be Introduction, Definition of Phobia and Nosocomephobia, Predisposing Factors and Causes of Nosocomephobia, Symptoms of Nosocomephobia, Diagnosis and Tests, Preventions, Treated of Nosocomephobia, How to Deal with it, Living with, Study on Nosocomephobia.
Introduction. What is actually nosocomephobia? Nosocomephobia, fear of hospitals, is an intense fear of hospitals. It's a type of anxiety disorder that can cause symptoms and panic attacks. It may prevent you from getting important medical care or stop you from visiting loved ones. Nosocomephobia may be related to other fears, such as germs, disease, blood, or needles. Certain types of therapy can. First of all, what phobia is. Definition of phobia: fear caused by the presence or anticipation of a specific object or situation, exposure to which almost invariably provokes an immediate anxiety response or panic attack even though the subject recognizes that the fear is excessive or unreasonable.
Definition of nosocomephobia. Nosocomephobia is derived from Greek and Latin words. Greek nosos stands for diseases while comes is Latin for consequences or companion. Nosocomion is also the Greek word for hospital. Phobias closely related to nosocomephobia include hemophobia or the fear of blood, or iatrophobia, the fear of doctors, mysophobia, the fear of germs, thanatophobia, fear of death, and trypanophobia, the fear of needles.
People with nosocomephobia are overwhelmed by the fear. They might 1. Avoid hospitals, even when they need medical attention. 2. Get extremely nervous when they merely think about hospitals. 3. Panic when faced with the possibility of going to a hospital, even to visit someone else. 4. Regret not visiting a loved one in the hospital due to their fear. 5. Worry excessively about the possibility of having to go to a hospital.
How common is nosocomephobia? Nosocomephobia is more common than some other phobias. It can affect people of any age, starting in childhood or adulthood.
Are there different types of nosocomephobia? It may be related to other specific phobias associated with hospitals and healthcare, including agoraphobia, fear of pain, carcinophobia, fear of cancer, claustrophobia, fear of enclosed spaces, such as small exam rooms or medical tests that require confinement, hemophobia, fear of blood, iatrophobia, fear of doctors, mysophobia, fear of germs, nosophobia, fear of disease, tomophobia, fear of surgery, pharmacophobia, fear of medicines, thanatophobia, fear of death, trypanophobia. Predisposing factors. Causes of phobias are unknown. However, various theories exist that may offer insight into the etiology. 1. Psychoanalytic theory. 2. Learning theory. 3. Cognitive theory. 4.
Causes of it. Its roots are related to the phobic past. Hospitals are also known to beggarly places. Hospitals are often seen that life is short and that people die in them. Patient is out of control and is completely at the mercy of the doctors and nurses. News, media reports or TV movies about hospital mishap. Now, what is the symptoms of it? Full-blown panic attack, running away, shaking, shivering, trembling. Or, feeling nauseated. Or, experiencing elevated heart rate, shallow and rapid. Continuing to symptoms. Client may also experience excessive sweating. And avoidance behavior. Refusing to go to the hospital can often lead to very serious consequences. Or, feeling uncontrollable anxiety. The phobic might feel detached from reality or feel like he is going completely crazy.
Diagnosis and tests. A healthcare provider can diagnose a specific phobia based on discussions with you about symptoms, how long they've been happening, whether they're interfering in your life. Diagnosis depends on whether your fear causes extreme anxiety, leads to significant stress or affects your daily life, has been happening for at least 6 months, is out of proportion with any actual danger, makes you avoid hospitals, even if you want or need to visit one, produces physical symptoms of anxiety or panic attack.
Prevention. How can I reduce my risk of nosocomephobia? Mental health professionals don't fully understand the causes of specific phobias like nosocomephobia, so there's no proven way to prevent it. However, if you have a phobia, You may develop or already have other anxiety disorders, such as panic disorder or obsessive-compulsive disorder, OCD. It's important to work with your healthcare provider to manage any symptoms of your first anxiety disorder to prevent others. You may be able to lower your risk of nosocomephobia by limiting alcohol and recreational drug consumption, lowering stress during everyday activities like working, quitting smoking and other forms of tobacco use, spending time with loved ones, taking up a new hobby to take treatment of nosocomephobia. Much like the treatment of other phobias, nosocomephobia is also treated using a combination of medicines. Psychotherapy. Doctors might prescribe some anti-anxiety medication, but this is not recommended for long-term use. Hypnotherapy and talk therapy are other proven measures of overcoming the phobia. Self-help techniques like yoga and meditation.
عذرا احنا حكينا كثيرا، خلي الشباب تحكي جزئية. يلا روح يا رامي.
استلم الدفة يا منيب. يلا صبحي، مش غلط تشاركوا. أبو أيوب، طولت وأنت قاعد. هذه الشريحة بتحكي عن الملخص. لو كان بهمك
شريحة المراجع. ارحمني، هو حدا